Hello, everyone. My name is Lisa Bailey. Welcome to this May 5th message session on World Hand Hygiene Day. And the theme is Unite for Safety, Clean Your Hands. Now, when a health facilities quality and safety climate or culture values hand hygiene and infection prevention and control, this results in both patients and health workers feeling protected and cared for. But everybody, people at all levels, can work together through clean hands to meet the common goal of safety and quality in a healthcare delivery system. A strong quality and safety culture will encourage and support people to clean hands at the right times and with the right products. As I said, the slogan for this year's campaign is Unite for Safety, Clean Your Hands. And today we have a panel of people here who work in this area to talk about why this is so important, why it's important for both patients and healthcare workers, and why it needs to be prioritized at every level in healthcare facilities. So, as I told you, I'm Lisa Bailey. I'm Specialist Communications for Health Promotion in the Caribbean Office of the Pan American Health Organization. And I'm pleased to welcome Mrs. Catherine Vogel Johnston. She is an infection prevention and control consultant with the Pan American Organization. She began her career in infection prevention and control in 1980 in Norfolk, Virginia, where she then moved to Florida in around 1986. But then she moved to the Caribbean in 1996, where she worked in the Bahamas for several years. She came to PAHO as a consultant, but is currently working as a private consultant, still working in this very important area. And we're very pleased to have her be a part of the conversation today. We also have Dr. Jonas Gonza Garcia. He's serving as PAHO's advisor in quality in health systems and services since 2017, and also during the period 2006 to 2009. Prior to this, Dr. Gonza Garcia worked at the national and at the local management level in Spain and as a technical expert in tertiary and primary healthcare in Spain and Ecuador. He was a member of the steering committee of the IBEAS study, a pioneering study on patient safety in 58 hospitals in 5 countries in Latin America, and has worked for more than 20 years as an advocate for quality improvement and patient safety. So, welcome, Dr. Jonas. Thank you for being with us. And what I love about this conversation is that we also have 2 champions of infection control from right here in the Caribbean. Mr. Engelbert Emmanuel from Belize. He's Director for Infection Prevention and Control in Belize since 2014, and he also serves as epidemiologist and surveillance officer prior to becoming the director for IPC, and has done many trainings with PAHO and with the University of Australia. So welcome, Mr. Engelbert Emmanuel. And I'm also pleased to welcome from my hometown of Barbados, the most honorable Dr. Corey Ford, as he was recently dubbed by the government of Barbados. He is the head of isolation facilities and infectious disease specialist. He is a graduate of the University of the West Indies, and he also pursued a subspecialty training and returned to Barbados in 2014 after training in South Africa and Canada. He is the head of infection prevention and control at the Queen Elizabeth Hospital, and he is currently chair of infection prevention and control and director of the HIV/AIDS adult program and director of the antimicrobial stewardship program. Dr. Corey, I am not going to be able to give you all of the titles you have. Suffice it to say, he has worked in infection prevention and control for years, and his work has come to the fore in Barbados, certainly as a result of the pandemic. So, welcome everyone. Let's start our conversation. We are live on PAHO Caribbean and on PAHO TV on YouTube, and we really hope that you will be a part of the conversation. Feel free to drop your questions in at any time. So I'm going to start with you, Mrs. Catherine Vogel Johnston. Start by telling us what exactly are healthcare associated infections. Why are we even having this conversation?
Thanks, Lisa. It's a pleasure to be here. So healthcare associated infections, or HAIs, we used to call them nosocomial infections or hospital acquired infections. And these are infections that patients acquire during the process of receiving health care that weren't present at the time that they presented to their health institution. They often occur in the form of surgical site infections. They may be associated with medical devices that we use to treat and cure their underlying illnesses. And they can affect any body system that the patient has. And then what's important to note is that not only are patients at risk for these infections, but so are healthcare workers. And we've seen that most notably when our healthcare workers acquire hepatitis B or hepatitis C or HIV in the past. But with sharp safety programs, we've seen a decrease in that. But COVID brought it home to us as well when many of our healthcare workers acquired COVID at their places of work. So it is important that we learn how to prevent these infections in both our patient population as well as keeping our healthcare workers safe.
Thank you. Now, when we started preparing for this conversation, I was the first to mix this up with hand washing day, right? And they quickly let me know this is different, Lisa. This is a slightly different market. We're talking about healthcare workers in particular. Yes, patients too. So I am already learning so much from you all. Are these diseases common? Is this something that we need to be very aware about as healthcare workers and when we're in healthcare facilities? Dr. Johnston.
Well, Lisa, the global burden is really unknown because of gaps in surveillance systems that we see in a lot of the middle income and low income countries. But in 2009, the World Health Organization did note that about 5 or 15% of patients who are admitted to hospitals in developed countries will acquire these infections. And if patients are admitted to intensive care units, then that can jump to 9 to 37% of those patients. And in fact, in the US, the Centers for Disease Control's Agency for Healthcare Research and Quality reported that healthcare associated infections are the most common complication associated with hospital care. So what are we talking about in terms of actual numbers? In Europe, about 5 million healthcare-associated infections occur annually. Closer to home, the United States had 1.7 million patients in 2002, and it actually contributed to deaths in approximately 99,000 patients. So the extent of these infections in the developing countries is largely unknown just because of the lack of data. But it is an important concept. We should be concerned with it. And the numbers, we're starting to see the research that talks about how many of our healthcare workers acquired infections during the time of COVID. So stay tuned for those numbers because we know that there's a serious impact with that.
I'm going to stay with you.
And indeed.
Oh, go ahead, Jonas.
Yes, and indeed, adding to that, we have to say that's happening every day in every healthcare facility, mostly in hospitals, as it's an environment, a point of care in which it's more critical, the risk of those infections is higher. But the good news is that those infections are preventable and evitable if we put in place the correct way to avoid them. And if there is something which is basic, absolutely basic, it's what we are celebrating today: hand hygiene. Hand hygiene, and you said hand hygiene, hand washing. Well, the difference is clear. Hand hygiene is indeed broader. It includes hand washing with water and soap. But in order to make it happen, which is the most relevant thing, making it happen every time in every point of care, we have a solution which makes it easier, which is those alcohol hand wraps that I think that now everyone, not only healthcare workers or people who is in hospital or knows. So it's a way to make it so easy to just in a short movement of the hand to have the possibility to put the alcohol hand wraps in your hand and really have safe hands.
Thank you so much. No, I think it's good that we're talking about this because I feel as though this is something that we know exists, but perhaps we don't like to talk about. Let's go to the countries now for a little bit, maybe starting with Barbados, because I saw Dr. Corey just recently at the isolation facility when we visited there with the WHO director, and we were commenting on how many places there were to clean your hands everywhere. Dr. Corey, do you think that this is recognized as a problem, as something that can be prevented and is being prioritized, or do we need to do more in this regard?
thanks so much for that, and thanks for visiting our unit where we manage COVID patients. This whole idea of hand hygiene, I always say hand hygiene 101 is important, and the tone of the topic of uniting in hand hygiene, I think, is very important. Certainly not only for Barbados, but something that's typically important regionally. I think most countries need to look at what type of programs that they actually have on the ground, and I think it's all seasoned, to my mind, by one particular element. There must be the political will across the region in general to understand the importance of hand hygiene and, by extension, the importance of infection prevention control. And if we took a look at, I think this is what you're asking me, is if we took a look at our own national standards and program as it relates to hand hygiene and other infection prevention control programs, the lead must really come from the national level. And this is something that we've really worked on, certainly in Barbados, having our own national infection prevention control committee, for which everything really feeds out on, whether it be acute care facilities or long care facilities. And within that, what is also important is that, yes, we can have that political will, but the resources to make things happen on the ground certainly need to be there. This includes both physical and human resources, which is something that we've certainly worked on. So, I mean, all of our facilities have now infection prevention control programs, and the lead in those programs is first thing in those programs to make sure you have a high hygiene program. Within those programs in itself, on the ground, we have a general campaign for hand hygiene, which is constant, which is that stop, think, go platform, traffic light program. So when people come to their main acute institution, the first thing they see is this huge postage which says stop, think, go, elevating that aspect. But it's okay to stop, think, go. You have to have the resources. So when you go and push that hand sanitizer, then there needs to be hand sanitizer in there, and it needs to be throughout the whole facilities, throughout the ICUs, throughout the wards. You must have ready access to this. And the last part of this I would mention, which is a very important part of our program, and I think looking at the regional programs, which is important, is actually this. So auditing. So you need to audit how people actually do hand hygiene, or actually if they actually do it. And that auditing process comes to two measures to my mind. One, auditing to make sure that the procedures are correct, and then part of auditing and surveillance of those reporting. So not just report to the heads, administration, but report to individual wards, individual units, and provide them with the percentages. Hey, your hand hygiene rate is 50%. Your hand hygiene rate is 40%. Your hand hygiene rate is 100%. It encourages the units kind of like, to go against each other to say, hey, look, we have to do much better within our units. And I think that's important. But also auditing usage of products. And this is something that's often not done. But it's all the usage of products across the facility will tell you how good as well your hand hygiene processes go. And I often love the fact when we know we filled and it's empty, it means it's being used. So I think those are all key aspects that we've certainly focused on in Barbados. And ultimately, if we get hand hygiene right, then we'll get many other things right, including antimicrobial resistance and all the challenges I believe that go along with it.
Thank you, Dr. Ford. I'm going to go to Belize now, so you could give us your perspectives from Belize.
Good morning, everyone, and thank you, Dr. Ford, for the information shared. Indeed, it takes a lot of effort in the country to respond to our hand hygiene program that we see. And one of the key is to have a national program that does the championing in terms of coordination, ensuring that all is in place, but most of all to have the support from management. Support is of utmost importance. One of the things that we have seen over the years is having the support from a financial perspective. Yes, we do not have a specific budget for IPC, but one of the things that we know is that we get the constant support from our superiors, our leaders, in terms of helping us to champion IPC measures in Belize. But key is to have in place your relevant resources, meaning your personnel. You need to have your personnel on the ground who does constant monitoring. And For us in Belize, there are 7 major facilities. And in those 7 major facilities, we have infection control nurses. There is a program, and the program is guided by a policy and a guideline. And what is done on a routine basis is monitoring, which is very, very key. We may have all the resources, we can have all the soap, all the water 24/7, but if we do not monitor and we do not provide feedback, we will not be able to build that environment that we need to have within our health facility to reduce the risk factors that may potentially be there to cause a transmission of pathogens. So building that culture is very important, and you have to build it from the highest level to the lowest level. And one of the things that we have seen in Belize that help us a lot is not only having the supplies or the nurses monitoring, but also having our housekeeping staff who also ensure that these hand hygiene stations are maintained, they're clean, the supplies are continuously being replenished, and they provide feedback to our infection control personnel in terms of irregularities that they may see from time to time. So that is very key for us here in Belize, having the infrastructure in terms of the requirement that is required. And another thing that is very key for us is that we have our licensing standard. Our licensing standard in Belize incorporate IPC, IPC being one of those major components for a facility to pass or to get a license here in Belize. So that helps us a lot in promoting all IPC measures, including hand hygiene. So we focus and we zoom into these activities on a quarterly basis. We have our national focal point who goes into these facilities and ensure that the infection control nurses, they do accordingly as planned. Whatever gaps is identified, if it's related to capacity building, a training plan is developed. We focus in terms of the target audience. We develop material to meet the level of understanding. We do demonstration. Our nurses does demonstration. We try to incorporate good practices from one institution to the next. So we meet on a monthly basis where we would share information and report to see how things are coming along in the health facility as it relates to not only hand hygiene, but all other IPC measures. And again, having motivated staff is very important, because if you don't have staff that is motivated, they will just sit there and leave things as it is. So we have to champion from our level nationally and from the local level so that we get our clinical and our non-clinical personnel within the health facility very, very much involved. During the pandemic, we have seen up to our securities them very, very much involved. They were willing to gather information in terms of what they need to do to ensure a safe environment. So we had seen a shift in culture during the pandemic and up to now. So it takes a lot at the end of the day, but resources, as Dr. Ford had said, is very important.
I think, as you said, the pandemic has brought to light that whole thing about uniting. That this is not the job of one person to do.
Exactly.
Everybody has a role to play in this. If you don't mind, I just want to go to Dr. Jonas Gonza Garcia now. So we recognize the importance of hand hygiene. So let's talk a bit about when it should be done and by whom, and how do we make this routine practice?
Okay, it might be simple. It should happen every time when we are in a healthcare setting, in the point of care, and it involves any hand touching the environment of a patient or touching the patient before and after that contact. So, for sure, nurses, doctors, housekeeping professionals, all healthcare workers, but also the patients, the family, the visitors, the patient. That's something that speaks to all of us. Because of course, microorganism doesn't choose the hands of a doctor or a visitor of a patient. if there is the opportunity, they get into our hands, and so we can infect our beloved patient or the person we are visiting. So that's something that speaks to all of us. And for sure, if there is something which is absolutely central, is the role of healthcare workers. And we have to say to them a big, big, big thank you for all the efforts. We have to celebrate when we really improve. And that's been said, we need resources, but not only resources, we need that culture of continuous improvement to learn from the opportunities we saw. If we saw that we are having problems related to infrastructure, to that we don't have enough material, we need to point to that and to say, from all our different roles, well, that's an opportunity to improve, and that we need to prioritize, because we can monitor and give feedback on compliance with hand hygiene, but most relevant, we can monitor and give feedback on infections. So that's something very, very, very clear. And when you see how those infections that happen in every hospital, in every facility, in the best facility of the world, you will have some level of infection. So when you see dropping the numbers of those infections, you know you are saving lives. You are improving the well-being of the family, the patient, and the impact, the strong impact that has on the family and the communities. So that's really something that we get together every 5th of May to remember that, to reiterate message, but that's so important to sustain that and to move forward. As it's been said, we all have a role, the managers, the health authorities, the healthcare workers, for sure. Thank you, healthcare workers, but also the patients and the family and all visitors to patients.
Let's talk a bit about, because I mean, you can have rules for the staff, you can train the staff. Let's talk a bit about the role of patients and family members who visit. How do we get them to understand the importance of this when they visit healthcare facilities, beyond putting up a poster? Because putting up a poster alone, I'm sure, will not do it.
For sure. And the main point, our objective is making things happen and improving from where we are, so that the next step in which we evaluate the situation is better. And if something has failed, trying to change. So in every context, we need to understand the cultural background, how we can engage family, how we can engage the people who visit the healthcare facilities, so they play a proactive role in a respectful environment, of course, and consistent with the cultural background. But you can just promote campaigns to put the message and to make it clear how to do hand hygiene. What's that concept of hand hygiene, hand washing? How to make it physically. So to promote and to replicate those trainings to everyone, even for any new healthcare worker that enters into an institution, he needs to know the central role of hand hygiene in preventing and controlling infections. So that's something that, because we have some material, educational material, or because we have some campaigns present in the hospital, that's been done. We have to maintain every day that message alive. And there are many opportunities in different healthcare settings on getting the patients and the family really working together with the healthcare workers.
Thank you so much, Dr. Gonza Garcia. Let's go back to the countries now. I want to hear some of the strategies and programs that you have been using to promote hand hygiene in the healthcare facilities. Let's go to Barbados first, Dr. Ford.
Right. So some of the strategies that we've used, and I think we've looked at it from two perspectives. Strategies in terms of how we deal with patients on the wards. Strategies, for example, of how we actually get the healthcare workers to recognize the importance of this. So I think the first thing which we've really implemented is that basically for all doctors, all new employees within the facility, they must go through an IPC program before they start employment. That is an absolute prerequisite. It's almost like part of the pre-employment screening process to ensure that everybody understands that this is the minimal amount that you should know before you start being employed at all levels. Whether it be an administrator, whether it be a board member, you have to go through the same IPC training. That's number one. So that's the first, and I think one of the most important things that the actual individual actually knows that. The other thing that we do is it's a continuous process. And I think that most countries, certainly across the region, and many that I've worked with, I've said, look, one of the most important things is that on the ground, and what we do in Barbados is that hand hygiene is not only an employment process, but it needs to be, whether it's be monthly, bi-monthly, or even a bit longer, depending on the area which you're working in, that people need to understand the importance of hand hygiene. And why you do that is that people have to go through elements of training in hand hygiene. It's for them, sometimes it's annoying, but it's absolutely crucial. We know that 70% of people, we could, if we do hand hygiene properly, that we can really get down our rates in terms of hospital-associated or healthcare-associated infections. Some of the other things we've done on the ground, of course, we talk about posters, and we've allowed the staff and administrators to be involved with the process as well. So they help create some of the videos, the actual staff on the ground, seeing the actual administrators actually, doing hand hygiene and going through the process, and we kind of make it fun. We've also used the opportunity at some point to bring schools in, which is kind of interesting. So this is now for the public. So we brought schools actually into the institution on Hand Hygiene Day, and we've got them to do hand hygiene processes. We've filmed it and encouraged schools as well to do posters. We actually had a poster competition for hand hygiene within the facilities, within the various units, as almost like a competing type measure that we've used on the ground. And then lastly, I think probably more importantly is have inter-unit, I don't want to use the word competition, but it's kind of like what it is. Because we've seen people have rates of, if your rate is 70% of this unit and your other rate is 80%, 90%, you're going to feel bad. So people respond to that. And we don't use our normal. So I won't walk in the unit and do a process. None of the nurses would do that. We usually use people who they're not familiar with, who just come on the unit and just kind of linger around. So I think that's important. Those are some of the important measures that we've used on the ground. And being unique in this process is important.
That sounds great. I know that's a great way to get people involved. A competition part of the process and seeing themselves on screen and in material. So that's brilliant. And certainly young people, getting them as part of the process, I think makes a lot of sense as well. Let's hear about Belize. What are some of the strategies you've been using?
Well, as shared, I guess Barbados and Belize have several things in common. And as we look at our program and the way we would champion hand hygiene is that for all our healthcare professional who joins the system, there's an orientation session, there's an IPC orientation session. They have to go through those sessions, and once they complete those sessions, they would do demonstration likewise of those activities that they need to initiate while on the ground. We also ensure that our leaders in the wards, in the clinical setting, the supervisors, etc., they also monitor the processes in the facility. We try to include more infrastructure for hand hygiene to ensure that is being done, because one of the things that we see from time to time is the excuse that, oh, we do not have sufficient supplies. We are not able to move between patient beds to access because it's an emergency. So we try to put in structures in place, the infrastructure, so that they have the available hand hygiene supplies and the monitoring aspect that is very important by our infection control nurse. So they should go on the wards on a daily basis. They would do observation And what they do is to provide feedback immediately rather than go back and prepare a report and then create a summary and send it to others. But one of the key things, as we always know, is that information is power. And if we do not inform our clinical staff, our non-clinical staff, and the public, they will not be able to understand what is required from their end. So we also have our patient rights and responsibility and policy in Belize, which patients and family has a commitment to adhere to our institution requirement, with hand hygiene being one of those requirements to ensure a safe environment for our staff and our patient. So at the entrance of our facility, we encourage our security to advocate. We encourage our staff to advocate as people enter, as they go into the ward. We ensure that the supplies are there. We monitor. So the monitoring system is very, very important. But capacity building is one of the key. We need to do ongoing training. We have been doing ongoing training. So from the observations that we do, the infection control nurses, they would go back and put together training plans, and they would do regular training to ensure that continuous capacity building. So it's not a one-time training. And they have to show us evidence. For example, the national program, when we go in, our national focal point want to see evidence. We want to see names, signature, who participated from the facility, sorry. We want to see what is being done for the patient by the infection control nurse, by the infection control team within the facility, because at the end of the day, it is not only our infection control personnel that is critical in terms of ensuring this environment, but also we need to champion others within the wards, within the system. And it's not only our clinical staff. We start with management. We have our cleaning staff, our housekeeping staff. We need to champion these individuals, likely for them to ensure this environment for hand hygiene. So Belize had maintain the capacity building. We do monitoring, we do orientation session, we do observation, we provide feedback. But again, I believe that we can strengthen the feedback aspect, and we can utilize more in terms of what WHO has to offer us in doing monitoring, and to do more documentation. Another thing, commitment is very important, because if you don't have the commitment from management, we will never see this work at all. So it starts with our management being supportive, and the community understanding their role in terms of the prevention aspect and the impact that they will create on themselves. So we have to ensure to sell the message the right way, because if we don't sell it the right way, we will not get that shift in culture. And culture, we know, can actually cause a lot of irregularities and resistance if we do not present the right information in the right form and at the level of understanding. So that is very important as we target our different groups within our country.
Agreed. And I mean, it just, the theme is perfect, because we do need to unite for safety and clean our hands. I think I'm going to stay with the countries for a little bit, because I want to know, during the pandemic, did this become easier? I know personnel would have been overstretched. I want to hear about your experience. Did the situation affect hand hygiene compliance, or did it make it come to the fore and more important? Let's go to Dr. Ford first.
I think that's a real brilliant question. And the truth is, I think globally, whether the average individual now understands the importance of hand hygiene. I think that if there was one benefit, it sounds a bit strange, if there's one benefit to the pandemic, is that learning how to do the appropriate hand hygiene measures became a thing on the floor. And in our institutions, the average individual wanted to know the right technique, what to use, even down to looking to recognize this is the appropriate agent and this is an inappropriate agent. I think all of those particular things came to floor in our facilities. Did it make it easy for us? You sure bet, because everybody wanted to make sure that they were safe in terms of not contracted COVID-19, whether it be at the long care facilities, whether it be at the acute care facilities, and this is for both patients and clients, long care facilities, acute care facilities, and the administrators. And the political will for ensuring that these agents on the ground were actually there also came to flourish. So maybe we may have had challenges in between, but certainly in the advent of COVID, I can tell you there were no challenges. Even at looking to see what, if we didn't have this, what are the other appropriate agents that would be required, or how can we make it even? I think we got even down to that particular level. And I think for us in Barbados, that's important. But I forgot to mention before, champions. And I think within the COVID pandemic, what we're able to do is to create a host of champions throughout the institutions, whether it be long care, acute care facilities, which champion this event in terms of quality improvement. And that quality improvement came by focusing a lot in terms of hand hygiene within the facilities. And then partnerships. So partnerships became important, partnerships with you guys, certainly at PAHO, but partnerships with many non-governmental organizations in ensuring that we got the right products and that the products were being used across the facilities appropriately. I think all of these measures, I think it made it much, much easier. And having having already built a backbone regionally, working with many of the countries across the region, like the Antigua or St. Lucia, or many of them that we've worked with, it allowed them, that backbone was just built on in the pandemic. So I think it became much, much easier.
I think you all were in the background, the unsung heroes until the pandemic, and then everyone knew about infection prevention and control. So at least that was one good thing that came of the pandemic. There might have been a couple others, but you know, it is what it is. Mr. Emmanuel, what about you? Did it come to the fore for you as well?
Indeed, we have seen great improvement. One of the things that Belize had experienced, I guess, like every other country, is that everyone became an IPC specialist. Everyone wanted to know, they wanted information, they were hungry for information. I think the scare that actually hit us had caused that eagerness for people wanting information to know the right processes. It was a challenge for us at the beginning, but one of the things that we saw is that it had improved the environment. Everyone wanted the knowledge, they wanted to know, or management wanted to know what role they played in terms of improving. What are the right supplies, the right hand hygiene supplies, where we need to place hand hygiene stations. So we had seen an improvement. The community was also hungry for information. They wanted to know how to protect themselves, not only with hand hygiene measures, but in all form and fashion. So I guess the scare had led to a vast improvement. We have seen more monitoring, enhanced cleaning, even though we have seen staff being ill, stretched thinly. One of the things that I saw in Belize is that they came together, they pooled together to do and get the job done. So it was very important. So when one set was down, another set was available. And if both set was down, there were other people who could have carried through. Because the infection control nurses, they were in dual role, you know, not only doing IPC, but they were doing surveillance and many other things. So it was a different experience for us generally. But one of the key is the stakeholder engagement. I think that was very important. We had different stakeholders that helps to advocate across different sectors. And I guess as we got to different population and to different business community and institution, that's where I guess we had built our strength. We had a national response team that coordinated all the pandemic response in Belize, and health was a forefront, you know, in terms of the prevention aspect. And I guess the posters, the material, the support given from the highest authority in Belize, or the highest level, was what had led to this vast improvement in terms of the changes that we see, because the pandemic actually had led for us to increase hand hygiene station, and without the finance, we would have not been able to do so. So our Ministry of Finance, which was part of our stakeholder, was very crucial and critical. There was a pandemic budget that we have and that we had for health, and we felt so special because health was the ministry that was getting all the attention financially. So for supplies, etc. But there were other measures that may had impact us too. But generally, we have seen an increase. Things had improved. Everyone became knowledgeable in terms of hand hygiene and IPC measures.
I think someone mentioned the need to document. Maybe that's how we can keep this momentum and we don't lose the funding that we need for all of these important things. As we get close to wrapping up, we want to remind you that we have a lot of materials on our website. You can see it coming up on the screen. Make sure to visit our website for any materials that you want to use talking about hand hygiene. I'm going to ask everyone now to maybe give me one last recommendation or advice to strengthen the safety climate or culture to promote hand hygiene. So give me one recommendation to strengthen a safety culture to promote hand hygiene. Let's start with our PAHO colleagues first. Let's go to Dr. Jonas.
Thank you. Well, let's make it happen. Let's maintain the momentum of investing in health, investing in preventing and controlling infections. That has a strong impact on health, on well-being of people, but not only that, this is efficient. And it's absolutely so linked to other big risks we have as the antimicrobial resistance. So really putting resources on all programs to prevent and control infection really will pay off in all senses and in all levels.
Thank you, Ms. Vogel Johnston.
Yes, I think leadership and visibility are key to keeping the momentum going and making sure that people realize that hand hygiene is everybody's job, as is infection control, infection prevention and control. So leadership and visibility to keep the momentum rolling.
Sounds good. Good takeaways. Dr. Corey Ford?
I'm going to be short. Stop, think, go.
I like it. And back to Belize.
Well, one of the key things I think is to sell it, ensure that we keep our parties engaged, our stakeholder engaged. Information is very powerful, and I think that is one of the key for you to engage and keep our community, our individual engaged. And your approach is one of the key. And once you have the right approach, the right environment, you will see the change in culture. So my thing is your approach, your communication, and your engagement, and ensuring everyone is engaged. Don't leave anyone out. Everyone wants to feel important. So that is my advice.
Wonderful advice. Thank you so much. I think those were some wonderful takeaways. To the unsung heroes in infection prevention and control, we see you, we salute you, and we salute all of the healthcare workers who have worked throughout this terrible pandemic. We've learned a lot from it, but we really want to see it go away, but we don't want to lose the lessons that we've learned. We do have a video we want to share with you before we go, so I'm going to ask my tech team to share that video with you now. And we'll be back right after this quick message.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
So that quick message was just to remind you how to safely wash and clean your hands. Remember, we're uniting for safety. Please remember to clean your hands. Happy World Hand Hygiene Day. Thank you so much to my panelists. I learned a lot, and I hope you, the persons who visited and listened in on this conversation, learned something too. Thanks so much for joining us. Thank you so much, panelists, and continue to enjoy the rest of your day. Until the next time, thanks so much for watching. Bye for now.
Bye.